Mr. Secretary, welcome. Please go ahead.
Well, thank you very much, Mr. Chairman, members of the committee and the subcommittee. My name is Robert Reich, Chancellor's Professor of Public Policy at the University of California at Berkeley. Thank you for giving me this opportunity to testify before the subcommittee. Let me just begin by saying it would be hard to invent a more expensive and less effective healthcare system than we have here in the United States. Even before the pandemic, the typical American family was spending more than $6,000 a year on health insurance premiums. If you add in co-payments and deductibles, the doctors, hospitals, and drug companies also charge, that sum increases to $6,400. Add in typical out-of-pocket expenses for pharmaceuticals, and it's at least $6,800. And that's not all, because some of the taxes the typical family pays are for health care too, for Medicare and Medicaid and the Affordable Care Act. Add them in, and the typical household pays $8,975 a year for health insurance. This number does not include what typical workers' employers spend on their health insurance, which might otherwise go to their wages. American spending on health care per person is more than twice the average in the world's other 35 advanced nations. Yet, and here's where we come to ineffectiveness, the United States ranks near the bottom among advanced nations for lifespan and infant mortality. Americans are sicker, our lives are shorter, and we have more chronic illnesses. Canadians, for example, can expect to live an average of almost 4.5 years longer than Americans, even though health care spending per person in Canada is only half as high as in the United States. The connection between the high cost and ineffectiveness of our system is clear. Because healthcare is so expensive, many Americans put off seeing a doctor until their health has seriously deteriorated. Even with the Affordable Care Act, there are tens of millions of Americans who have no health insurance coverage at all. One major reason for the extraordinary cost is the administrative costs involved in private for-profit insurance. About a third of what the typical American pays for health insurance goes to the people who oversee billing and collections. And then, of course, there are marketing and advertising expenses, and the profits that go to shareholders or private equity managers. Replacing private for-profit health insurance with Medicare for all, would lead to far lower total costs, and I'm including premiums, co-payments, deductibles, and taxes. And it would cover all Americans. People could keep their same doctor or other healthcare provider and could buy private insurance to supplement it, just as some people now buy private insurance to supplement Medicare and Social Security. And finally, if the pandemic has taught us anything, is that we need to decouple health insurance from employment. Losing a job should not mean the loss of a family's lifeline to healthcare. The Affordable Care Act was a good start at reform, but as Medicare and Social Security have demonstrated, we should not have to pay private for-profit insurers boatloads of money to get the insurance we need. Now, I have no illusions this is going to happen soon, but the road we're now on is unsustainable economically, politically, and socially. Eventually, we're going to have some version of Medicare for all. The question is how much unnecessary cost and hardship we must bear before we do. Thank you.
Secretary Reich and Dr. Benjamin, for both of you, First Secretary, you and I both talked about the overall costs and the underperformance of the American healthcare system, and you mentioned a little bit about what we get for that. So the outcomes don't nearly replicate the investments for the Americans. One thing, and Dr. Benjamin in particular, of those outcomes point members to a really wonderful study by the Kaiser Family Foundation about life expectancy internationally. comparing countries for people over 65 and also regionally. Here on the West Coast, the United States would be 13th out of that study in nations, but then regionally, California and the West Coast would be first in the world if it was a country for life expectancy. They're now diving into that. But as somebody who's a survivor of chronic cancer and has spent 4 weeks in an ICU, I've seen the best and the worst of American healthcare personally. The public option we have here as a former small employer owning restaurants, we use that and it's on our exchange. So it helps the employer. So the question for both of you, starting with Secretary Reich, is what do we get out of this? Not just consumers, but our economy and businesses, and particularly small businesses.
Mr. Chairman, the costs overall of healthcare are increasing dramatically. They're now 19% of our entire economy. Within the next 5 years, if present trends continue, we're going to be up beyond 22%. When I say that that's not sustainable, I mean it's not sustainable not only for the individual, it's not sustainable for the nation as a whole, because there are a lot of other things we as a nation need to spend our money on as individuals and as a country. Pharmaceutical costs are skyrocketing, but it's not just pharmaceutical costs. It is also all forms of hospitalization and medication, as well as tests, machinery, equipment. Now, it has been pointed out, and I think it's true, the United States does have, for those who can afford it, a terrific medical system. That is, like many other areas of our national life, if you are very wealthy, if you are able to spend the money, you can get better health care here than you can almost anywhere else. The problem is that not only is it expensive from the nation as a whole standpoint, but from individuals who are middle income or working class or poor, it is simply unaffordable. And we have a lot of data showing that people, because of mostly the high deductibles or co-payments, but also because they don't have insurance to begin with, do forego the kinds of medical care they need that would have prevented more serious problems, particularly diabetes and certain forms of cancers and other potentially preventable diseases that are extremely expensive to deal with once they get out of control, as it were. So again, Mr. Chairman, both on the standpoint of the nation and on a standpoint of the individual, we are not doing nearly as well as we should. We're on a trend line that is unsustainable, and we are not doing nearly as well as comparable nations.
How would addressing out of control drug prices to bring them more in line with those paid by other countries create a fairer system for the American people?
Let me just say, Congresswoman, that retail prescription drug spending per capita by country, and I have in my testimony a chart to this effect, is relative to any other advanced country. The United States is spending far more per person. We're up to about $1,500 per person. And there is no doubt, and there are a number of studies, that if the federal government were to use its bargaining power through primarily Medicaid and Medicare, but also veterans, that bargaining power would be substantial in terms of lowering drug prices. Having worked in and around Congress and being Secretary of Labor and so on, I can tell you something that obviously is an open secret. One of the reasons that the pharmaceutical companies are so opposed to allowing the federal government to have that kind of negotiation power at the federal level is because they're afraid that the federal government could actually reduce the increase in drug prices or reduce drug prices overall.
So thank you. And so Secretary Reich, given this significant taxpayer support for the development of new drugs. So then, how do you respond to the arguments by drug companies that high prices are needed to foster innovation?
Well, I don't think that is true. There's a great deal of innovation by drug companies in other countries. Switzerland would be a good example. The National Institutes of Health provide American drug companies with extraordinary help in basic research. Not the development side, that's up to the individual companies. But the basic research is paid for by taxpayers. It strikes me as unfair for Americans to, on top of that, bear the highest drug prices in the world.
So spending by public and private sectors together, aren't we already paying as much as we would nationally for universal health care? And if we're paying that much, why isn't the system universal for all that money?
Well, Congressman, that is the most important question I've heard today, in the sense that we are not getting nearly our money's worth. We have 30 million people who are uninsured, have no health insurance at all. They don't have any preventive care. Even those who do have insurance are paying co-payments and deductibles that are so high that they are deterred from seeing doctors. That means that they're not getting the preventive care they need, which is driving up the total costs. In the background of a lot of this discussion is an understandable concern about federal bureaucracy. But I want to just bring everybody's attention to the fact that the two most popular programs in history in the federal government are Social Security and Medicare. People rely on Social Security and Medicare. There's nothing socialist about these things. Social Security and Medicare are paid for out of basically payroll taxes. They are universal in the sense that they are available to everybody who meets certain criteria. With regard to Medicare, it's I should know I am now eligible given my age. Why not continue to lower the age of eligibility of Medicare? Why not expand what Medicare can do for people? Why not use the models that are available to us? I think the Affordable Care Act is enormously helpful. It is a step in the right direction. But given the scale of the problem and given how much we are spending as a society, as you say, more than 20% of our entire gross national product, gross domestic product, we can do so much better.
All right, but what about overhead? What's the overhead or the administrative costs of Medicare compared to, the private insurance?
Well, as I suggested in my testimony, there have been a number of studies looking at this specific issue. And what they show is that the overhead, that is basically the administrative costs for private for-profit health insurance, are substantially higher than the administrative costs of what might be called Medicare for all or Medicare generally. And the other aspect of these administrative costs, because you've got 1/3 of nurses' time, for example, looking at billing,
Yes.
and you've got all sorts of marketing and advertising costs. But there is another aspect to this that was brought up by one of your members just a moment ago, and that is the consolidation. We see in private for-profit health insurance more and more consolidation, which means more and more market power to drive up these costs. And that is another additional burden on many, many Americans.
Can you talk about the effect that Medicare for All would have on labor union bargaining and those wages and benefits that are bargained?
Yes. First of all, Congresswoman, by tying medical insurance to employment, as we now do, we find ourselves, more and more people are tied to their employment. At a time when not only have we been through a pandemic and we've seen how fragile that employment relationship can be, but also we have more and more people who are working part-time, who are contract workers, who are self-employed. We have probably the largest portion of our workforce in terms of growth right now are people who are not tied to individual employers. They really get shut out of a healthcare system that is employer-based. And we need, if you were just looking at trend lines, we need to make sure that they have portable health insurance. Labor unions, you ask, well, labor unions have limited bargaining power, obviously. What they are now doing is using part of that limited bargaining power, not on wages and working conditions, but on healthcare. This is something that if we had an established healthcare system, a Medicare for all system, like most other peer nations do, labor unions would not have to utilize their bargaining power on this particular issue. They could seek higher wages and better working conditions instead.
And it's why we have so many labor unions that are now supporting and have endorsed the Medicare for All Act. One last question. 1 in 6 Americans stay in a job that they don't like to maintain health coverage. So even worse, some people are forced to stay in unhappy and dangerous relationships to keep their health insurance. Secretary Reich, how would Medicare for All affect workers who want to leave their jobs or start a small business or do many other things, but feel that they're unable to?
Well, the job lock is the term we use. And that does mean that many people simply cannot get better jobs. They can't get worker training. They can't get out of relationships that might be abusive. They can't get out of workplaces that they find abusive. They are locked into jobs that they otherwise really shouldn't be locked into for a whole variety of economic and sociological reasons, but it's because of healthcare.
So they often say that it costs too much, that the public sector is less efficient than the private sector. The government bureaucrats will get in the way between you and your doctor. How would you respond to these claims?
If you look at our for-profit private insurance system and you ask about bureaucracy, concentration, administrative costs, all of the things that very people complain about, or the goblins that are created with regard to government. It is really a maze, M-A-Z-E. Anybody who has ventured into the system knows how complicated and impossible it is to get through. And one thing I tried to emphasize before is that Social Security and Medicare are the most popular programs in the federal government, but they're popular across the board. I don't care whether you're a Republican or Democrat, where you live. I mean, they're popular because they work, because they are relatively simple for people to navigate. Why don't we take something that works, like Medicare, and expand it to deal with a problem that we all have, that we all understand, that really makes our entire system less efficient and less humane, and that is Medicare for all. And I want to again compliment those of you who are leading the charge on this. There are very few things that are more important to average working people.
Thank you. Now, do these experiences of the other countries that have universal healthcare systems resemble the scenarios described by our opponents?
If you're still asking me, Congresswoman, there have been a number of studies, very good studies, and I'm happy to refer you to them, that compare the United States system to many other advanced systems and other advanced countries. They're not exactly alike. They are different in many respects. They're not all single payer, for example. They're not all what we would consider Medicare for all, but they all have elements of Medicare for all. And they are, they're not all great. I mean, there are some waiting times, there are some inefficiencies, obviously, but it's all relative. I mean, you've got to compare what they have, what they cost, and how many people they reach, and what job they do with our system. And I think that anybody looking at the data and making that kind of comparison can't possibly conclude anything other than the reality that most other advanced countries do it better, cheaper, and reach more people.
You indicated in your testimony that the Medicare for All could save $21 trillion over 10 years. The public option wouldn't cover as many people, but could we expect similar cost reductions with a public option that we could with a Medicare for All?
Well, I'm not sure that it would be similar, but the key with the public option, and that is definitely a step that could be taken, should be taken, in my view. The key is to make sure that that public option provides the same sort of insurance coverage that Medicare would provide, and that is that, and and we can't create a kind of Medicare Advantage situation in which you have for-profit insurance companies that are raking off and seeking to rake off through their marketing and advertising, just kind of skimming the cream. But if it is a genuine public option, I think that is could be a major step in the right direction.
Could I have one follow-up, Mr. Chairman?
Of course, Mr. Chairman.
Thank you. And if the public option is less expensive and more effective, would we necessarily have to eliminate private insurance?
No, and I think this is a false sort of goblin here. It is possible to do Medicare for all itself and still have private insurance. I mean, just like with Social Security, just like with Medicare itself, there are private insurance options. People can supplement what they get. And they keep their same doctors under Medicare, Medicare for all. It can be designed in a variety of ways. I think the key to it is to try to get the private for-profit insurers out of the picture so that people don't have to pay a fortune for the administrative costs, the marketing, the advertising, the profits, the shareholders, the private equity managers, and everybody else who is making a fortune off of our people and our government right now.
When this idea came up first, one senator said it would be unfair competition because the public option would be able to charge less and provide more. My reaction to that is, well, if that's the question, if that's the issue, let's just call the question.
Well, that's right. Bring, Mr. Chairman, you could say, in effect, bring it on. I mean, that's what we want. That's what the public needs.